Okay, let's try this again. Public health program planning. So we're going to do a quick review for the final paper and final presentation. So actually, let me look at the rubric real quick. So, sorry, let's start with the instructions. Again, I'm not going to read through all this, but essentially your final paper, have an introduction, talk about it, do a needs assessment. Why is there a need for this particular program? Um, we are doing with our discussion for week one, we did essentially a needs assessment using the CDC website. So you can use that information or another health agency or another source of information to essentially do your needs assessment, identify all the stakeholders, talk about the program design, the purpose of your program, what are the outcomes that you expect, how do you expect to achieve those outcomes, what type of activities are you planning, and then of course make sure that you have a qualitative and a quantitative measurement. So quantitative is numbers, qualitative is quality. How did the shareholders enjoy your presentation? And then of course a nice conclusion. Obviously, we're not actually implementing these programs. We're not actually gathering evidence to demonstrate this, but we are planning out how we would gather evidence, and we want to make sure that that plan is available, or clearly stated, I should say. So again, let's look at the rubric real quick. Make sure that you have a title slide. This is for the presentation. A nice introduction and reference slides, or of course, a full description of your public health program. The needs assessment, the background information, information about the shareholders, the activities, the outcomes. Make sure that there's a logic model, which I'll show you in a minute here, and then a plan for both qualitative and quantitative evaluations. And make sure it's organized and spelling is clear and everything is honky dory on that way. So real quick, this is this is the presentation that was included in the course materials. I just wanted to review it real quick. So again, a needs assessment. Each population is unique with regards to what is causing illness and death within the group. And there's great information out there. There's plenty of information that you can look at for morbidity and mortality rates within your community. And again, of course, we did this for discussion number one. So you don't have to use this discussion to find your needs assessment, but or to do your needs assessment, but it's a good place to start. Again, once you have identified a need, then try to do a literature search and try to find a public health program that is based in evidence that can meet the needs within your community. So, for example, if there is a big problem with obesity in your community, look for an obesity prevention program or an obesity treatment program, and make sure it's evidence based, and then kind of match your program or model your program after previous programs. Stakeholders or shareholders, any individuals or groups of people that are affected by your program or would be interested in helping out with your program. So here's some, of course, definitions of the different shareholders or stakeholders. And again, find people within your community that are actually going to want to help with your program. Okay, the state, federal, local health departments are all a good resource. Schools are always a good resource if you're looking for, if your program is aims towards the older population, then maybe retirement centers, things like that. They would be a good potential stakeholder. And look for grant money. Try and find somebody that is actually going to fund your program. Insurance companies are good for this. Or there's tons of grant money out there. So do your best to, you want to develop a program that's actually going to get funding. So do your best to try and find some funding sources. So once you have identified the need, you have identified the stakeholders, and then you want to start thinking about, well, what are the desired outcomes of this program? And then how are we actually going to achieve that? So again, going back to obesity, if your goal is to reduce the number of obese people in your area, the activities would be, health education programs, nutrition classes, things like that. So again, consider funding, and then very important, consider the stage of development of your program. Is this a pilot study? Is this the first time a study like this is being done? Or is this an expansion of an existing program? So I will give you an example of an expansion of an existing program with a concussion prevention program. This is a basic logic model, real simple. I took this right from the CDC. So you have your inputs, the early and later activities. You can simplify that into one column if you want, just have activities, and then same thing with outcomes and later outcomes. I will post an example of a logic model. And then your evaluation design. Make sure you have quantitative and qualitative data. Quantitative is numbers, statistics, total weight loss. If it's a smoking cessation program, how many people were able to quit smoking, things like that. So give us hard numbers. That's what we want to look for. And then qualitative. This is how you're essentially assessing stakeholder opinion. How did they feel about your program? So if your evaluation says that the participants lost a total of 2 pounds, over the course of a year, okay, you have a statistically significant weight loss, but it's only 2 pounds. That's not a big deal. But let's say everybody hated your program. They just completely disliked it, and the only reason that they stuck with it is because whatever, they were getting paid at the end of the program. So, whatever. But you want to make sure that the program was enjoyed and found useful by the stakeholders or the shareholders. And the way you do that essentially is just give them a survey, or a focus groups are a good way to do that. So we can talk a little bit more about that as we get closer. So about a little bit more about qualitative and quantitative design. One of our discussions is going to be based on that. So this is an example of a public health program that I put together for a local rugby team. Archbishop Carroll is a local high school right outside of Philadelphia. Last year, a couple years ago, they were putting together a rugby team for the boys at the school. It turns out that they couldn't get enough guys actually recruited for the team, so the team never actually got formed. But I was involved with at least trying to get people together to get this started, and we put together this program at the beginning. So this is essentially, I developed this presentation using the same tools that we just discussed. So just a quick introduction about, rugby. Rugby is great and everybody loves it, and it's becoming more popular anyway. But there's also a significant need for concussion prevention in all high school sports, but particularly rugby. And there are just under 4 million concussions every year. This is an estimate because probably half of them go unreported. I was a football and a rugby player for years, and I got my bell rung a number of times and never once went to the doctor for it. So it was just something that we did back then. It's gotten a little bit better, but not much. And rugby is probably ice hockey has the highest level of, or the highest rate of head injury. Rugby is a close number 2. And there's significant short and long-term effects from concussions. So, one of the main ways to prevent concussion is to recognize that somebody has been concussed, because the main risk factor for a concussion is a previous concussion. So if you can keep players off the field that have had a recent concussion, you can significantly cut back on the number of the total number of concussions. Because what happens is kids get concussed, or players get concussed, and they keep getting more and more and more concussions throughout the season happens. So this is an example of jumping onto an existing program. The CDC, the Center for Disease Control, put together this Heads Up Concussion in High School Sports program. And you essentially can order this program, and they send you all the information, all the training videos and everything. And they put together this wonderful program. And these programs are effective. For every $1 invested in a program like this, there's a return of $12.60. So that's a great financial incentive for this school to get involved in a program like this. So obviously it's we're much more concerned about the mental and physical health of the athletes, but the financial piece is important as well. So Additionally, for this, I work for Ursinus College. I do some work for Ursinus College. I coach their rugby team, and they have a pretty strict guideline. So we're going to use the impact testing, which is a neurological assessment, and then anytime we're suspicious that somebody might be concussed, we'll retest them, and then Ursinus gets to collect all of that great information. So the stakeholders in the activities. The coaching staff, of course, is the main shareholders or one of the main stakeholders. They have to be trained at the beginning of the season, and of course, they're the ones that are playing the players. So they decide who gets into the game and who rides the pine. And if you are recently concussed, you're not allowed in the game. If we're even suspicious that you're concussed, you're not playing until you get cleared by a doctor. And that's the way it probably should have always been, but unfortunately, this is the way that we have to really push to get these kinds of guidelines in place. The athletes, of course, are shareholders, major shareholders. Hopefully get the captains in to create that culture of safety, which unfortunately, again, is missing a lot of times. The parents, of course, are very important in this because a lot of times when you're concussed, you don't automatically have the symptoms. Sometimes they don't come for hours or days later, so the parents are crucial in recognizing symptoms. The administrators need to be involved in this, because if there's a head injury, you're supposed to, basically lay in a dark room for like a week. You're not supposed to do any reading or studying or anything. So they need to be aware that, if an athlete has a head injury, they need to have, a break from work or from schoolwork. So this is your logic model. The earlier activities, the later activities, the outputs, the early outcomes, and then the later outcomes. So for this one, this is a brand new team, right? So this says the later outcomes is the reduced incidence of concussion compared to a control group. We don't really have a control group. If this had been an existing team, if this team had been been playing for 10 years, then we could look at the rate of concussion before the program was implemented and then after the program was implemented, and hopefully the number of concussions is reduced. But this team is brand new, so we have nothing to compare it to. So one thing we could do is compare it to the average rate of concussion for high school rugby, or maybe just another team, that is in our league but does not have concussion protocol in place like this one. So you have a couple different choices about how to demonstrate that this was efficacious. And then some other tools that you can use. The impact testing, of course, all the training logs are there, and of course monitoring head injury. That's really important. And then wrap it up with a nice little conclusion. Okay, all right. Hope this was helpful. I think that was it. Oh, the references, of course. Make sure all your references are there. Properly formatted references, please. And that should be it. So hopefully this was helpful. And again, we have a lot of time before this is due, so we'll kind of finesse this over the next few weeks in the discussion boards. Okay, take care.